Yasmin Wadhwa and I am a zoology lecturer working at Narayana Institute. So today my demo topic is cardiac cycle. And now what is cardiac cycle? Cardiac cycle, it is a sequence of events which includes both contraction and the relaxation of the atria and the ventricle. Now if we talk about the contraction of atria, it means it will start pumping blood to the ventricles. And when will we talk about the ventricle contraction, then ventricle will start pump blood into the pulmonary artery or aorta. Okay, now let's start with the cardiac cycle. Now cardiac cycle, it includes 3 stages. First stage is joint diastole, which is of 0.47. Next stage is atrial systole. Other one is ventricle systole. Systole and diastole. Now systole here refers to the contraction and diastole refers to the relaxation. So when we are saying that joint diastole, it means both atria and ventricles are in relaxed state. And when we talk about the atrial systole, it means atria are in contracted state. And when we are talking about ventricle systole, it means ventricles are in contracted state. Okay. Now if we talk about total duration of the cardiac cycle, 0.4 second is of joint diastole and atrial systole is of 0.1 second. Ventricle systole is about 0.3 seconds. So total duration of cardiac cycles, so it is of 0.8 seconds. Now if we say ki in 1 minute how many cardiac cycles occur, so the answer is in 1 minute there are 72 cardiac cycles that will occur, and it is 72 times that our heart beats. Okay, it is because of this cardiac cycle our heartbeat will occur, and in 1 minute there are 72 heartbeats and 72 cardiac cycles occur. So let's start with the joint diastole. So first is joint diastole. Now in joint diastole, if we say our heart has 4 chambers, we all know that. In a simple way, we can say this is our heart. It has 4 chambers. It is right atrium. Now this is right ventricle, and this is left atrium, and this is left ventricle. Okay. Now, and during the joint diastole, right atrium will receive deoxygenated. From where it receives deoxygenated blood? It will receive deoxygenated blood from our body parts, and from the superior vena cava, which collects deoxygenated blood from our upper body parts, and inferior vena cava, which receive deoxygenated blood from the lower body parts. So it will receive deoxygenated blood. Now deoxygenated blood occurs and fill the right ventricle. Okay, and oxygenated blood will be received in the right atrium. Here there is oxygenated blood, and oxygenated blood fill the left ventricle. Oxygenated blood comes from the lungs. Okay, now this oxygenated blood will enter into the left atrium, deoxygenated will enter into the right atrium. Okay, now there is low pressure in the ventricles and very high pressure in the atria. So due to the low pressure, this AV valve means atrioventricular valve, that is the valve between the atria and ventricle, and as we all know, the valve between the right atria and right ventricle is tricuspid valve, and the valve between left atria and left ventricle is bicuspid. So these are AV valve which gets opened due to low pressure in the ventricle. Okay, this valve open up, AV valve open. So when AV valve open, there is free flow of blood from the atria to the ventricle. Now blood freely move from atria to ventricle without any contraction. So there is 70% filling of ventricles occur in the relaxed state. So it is 70% filling of ventricles occur. In which stage? In joint diastole without any contraction. Okay, clear? Now let's move to other state. Which is other state? Our atrial systole. Systole refers to contraction and atrial systole occurs because of SA node. We all know that the process of conduction, SA node gives signal to AV node, AV nodes further stimulate the signal. Okay, now atrial contraction occurs when SA nodes give the signal. So here SA node gives signal by which atria contract. Now when atria contract, what happen is the rest 30% filling of ventricles occur. In this stage 70% ventricles are filled and by this stage 100% ventricles get filled with blood. Right ventricle receive deoxygenated blood from atria and left ventricle will receive oxygenated blood from the left atria. Now ventricles are 100%. It means rest 30% filling of ventricles. Okay, clear that? Now next, after the contraction of atria, when ventricles are 100% filled, now to prevent backflow, what happen is कि AV valve get closed, because if AV valve will remain open, then blood from the ventricle will goes into the atria. Okay, now AV valve get closed. After that, okay. Now the next stage is, third stage is our ventricle systole. It means now it is a time for the contraction of ventricles. So what happen in ventricle systole is, now we say that the AV valve get closed out and ventricles are 100% filled with deoxygenated and oxygenated blood respectively. Okay, clear? Now when ventricle systole will begin, it means AV node gives signal, then bundle of His gets signals, and then Purkinje fiber will stimulate and ventricles get contracted. Now high pressure in ventricle occur and there is an opening of semilunar valve. Semilunar valve is present between right ventricle and pulmonary artery and left ventricle and aorta. Semilunar valve. Here is the opening of aorta and here is the opening of pulmonary artery. Now during ventricle contraction, blood starts flowing from right ventricle to pulmonary artery and left ventricle to aorta. Okay, it is the meaning of ventricle systole. Okay, clear that? After contraction, the semilunar valve gets closed. The duration of ventricle systole is 0.3 seconds. Okay, after 0.3 seconds, the semilunar valve gets closed. After that, semilunar valve gets closed. Clear? Clear that? Now, there are some terms first is stroke volume. What is stroke volume? It is a volume of blood which is pumped by each ventricle in one cardiac cycle. Means कि in one cardiac cycle, how much blood is pumped by the ventricle? In one ventricle. It is blood pumped by each ventricle in one cardiac cycle. It is known as stroke volume. Next is cardiac output. What is cardiac output? It is a volume of blood pumped by each ventricle in 1 minute. And in 1 minute, how much cardiac cycle occurs? 72 cardiac cycle. So, blood pumped by each ventricle in 1 minute, it will be equal to stroke volume multiplied by heart rate. 1 cardiac cycle means 1 heart rate and 72 cardiac cycle means 72 heart rates. Okay, stroke volume, general value of stroke volume is 70 ml and general value of heart rate is 72 per minute. So the total cardiac output is 5040 ml. Approximately 5 liter of blood will pump in 1 minute. Okay, thank you.